Patient is not a CT scan, it's not a fixed object in space. We all change during the course of time.
You clearly want a plan that matches your tumor volume if that tumor volume is changing. The challenge for us in the clinic is you're having to redo what you already did once before to create that new plan.
If you're used to doing one plan per patient, you're doing 2 plans per patient, and that of course will impact on the workload of physicists and dosimetrists and therapists.
Simply put, it's resources. It's the amount of time, the number of people, and not having necessarily all the expertise all in one place to be able to do it successfully.
And even if we had those resources, sometimes turning around a plan takes too long. So we can't get it in time to make a difference for that particular patient.
It's not simply just saying, I know where a tumor is. You also have to know how best to be able to incorporate that information into a plan that is both beneficial for the patient as well as doable in the clinic. Adaptive radiotherapy is a tremendous challenge. Currently, the tools that are in place right now require almost all the effort to be shouldered by the people who are doing treatment and are actually trying to also care for the patient in the clinic.
We need to make tools available for the clinician and the physicist and the dosimetrist that enable identifying the patient who's going to benefit from adaptive radiotherapy early and enabling us to develop a new plan in a quick and timely fashion without consuming a lot of resources.
The holy grail would be to have a system that allows you to do this in a few clicks of a mouse.
If the tools for adaptive radiotherapy were available for routine use, I think it would be a game changer for my clinical practice.
Treatment adaptation is no longer just a dream. Clinical dynamic planning will make treatment adaptation a daily working tool.
Being able to quickly assess what's going on with that tumor from day to day, week to week, is going to be huge for a clinician.
It gives them an ability to actually help their patients in a way that wasn't possible a few years ago.
And this is an opportunity to, to really help the standard of care.
And we want to get this improved care through to the patients as quickly as possible.
I think the dynamic planning from software from Philips has a potential of revolutionizing what we do in our clinic.